It is often assumed that the historical record of the Second World War is complete where it matters most. The belief persists that official documents, after-action reports, and post-war histories together provide a reliable account of how the war was fought and administered. When prisoner of war camps are discussed, the focus usually falls on numbers, regulations, and broad conditions, as if the system itself tells the full story. Yet this confidence rests on a record shaped by what administrators expected to see. When historians examine the files relating to female prisoners of war, it becomes clear that these records quietly reveal dimensions of wartime captivity that standard narratives often overlook. Prisoner of war documentation was designed to be efficient rather than reflective. Intake forms, medical logs, labor rosters, and disciplinary reports followed standardized formats, developed long before women were expected to appear in significant numbers as captives. These forms assumed a male prisoner by default. Names were entered, ranks recorded, physical condition assessed, and labor categories assigned with remarkable consistency. When women entered these systems, they were documented, but not necessarily understood. The record acknowledged their presence without adjusting its structure to account for it. One such case appears in camp paperwork from the early 1940s. The prisoner was a woman in her late 20s, captured while serving as a medical orderly with a frontline unit. Her capture was not extraordinary in itself. Contemporary accounts indicate that women in medical and auxiliary roles increasingly found themselves near combat zones as the war expanded. What makes her case notable is not her biography, which remains largely undocumented, but how she appears in the records. Her intake form mirrors those of thousands of men processed before and after her. Her name is listed, her uniform noted, her physical condition summarized in a few clinical terms. There is no separate category for her sex, no annotation explaining how she should be accommodated. The system recorded her efficiently and moved on. This absence of distinction is revealing. Prisoner of war camps were administrative institutions before they were humanitarian ones. Their primary purpose was to contain captured personnel, extract labor where permitted, and maintain order. International law, particularly the 1929 Geneva Convention, provided a framework for humane treatment, but it did not dictate how camps should be structured in practice. As a result, camp authorities relied on internal regulations developed around the expected prisoner population. That population was overwhelmingly male. Female POW records expose this assumption by highlighting what the paperwork does not say. In many cases, the absence of detail is more informative than explicit commentary. According to camp reports, women were often assigned housing based on availability rather than policy. Some were placed in segregated sections of existing barracks, others in repurposed buildings originally intended for storage or civilian use. These decisions were rarely explained in the official record. They appear instead as routine entries, a change of quarters, a reassignment of space, an adjustment to guard schedules. Medical records tell a similar story. Camp infirmaries were built to address predictable conditions associated with mass male captivity. Malnutrition, infectious disease, work injuries, and exposure were recorded using standardized diagnostic language. When female prisoners presented medical needs that did not fit these categories, the records often reverted to vague phrasing. Contemporary accounts indicate that doctors noted symptoms without elaboration, classifying patients as fit, temporarily unfit, or under observation. The forms allowed little room for nuance. In the case of the female medical orderly, her medical file shows an initial examination conducted according to standard procedure. Weight, general condition, and work capability were assessed. She was deemed fit for light duties. At this stage, the record suggests no disruption to routine. Only later do brief notes appear indicating repeated visits to the infirmary. The nature of her complaints is not specified in detail. According to post-war analysis of similar cases, This lack of specificity was common when camp doctors encountered conditions they did not feel equipped to categorize. The silence of the record here is not accidental. Camp doctors operated under pressure to maintain labor output and minimize administrative complications. Detailed medical exceptions required justification and sometimes approval from higher command. In an environment where resources were scarce and oversight inconsistent, ambiguity was often resolved through minimal documentation. Female POW records reflect this tendency. Rather than prompting systematic change, atypical cases were absorbed quietly into the routine. Labor assignments further illustrate the gap between regulation and reality. The Geneva Convention permitted the use of enlisted prisoners for non-military labor, subject to health considerations. Camp labor systems were organized around assumptions about physical capacity derived from male norms. When women were assigned to labor, records suggest they were often placed in roles aligned with existing gender expectations rather than military rank or training. Kitchen work, laundry, and clerical tasks appear frequently in female POW files. These assignments are listed matter-of-factly, without commentary on why they differed from standard labor details. This pattern is visible across multiple theaters of war. In German-administered camps holding Soviet and Allied women, labor rosters show small clusters of female names assigned to internal camp work. In Allied-run camps holding Axis female auxiliaries, similar patterns emerge. Contemporary accounts indicate that administrators viewed these assignments as practical solutions rather than policy decisions. The records, however, do not frame them as exceptions. They simply list them, reinforcing the impression that the system was functioning as intended. Disciplinary records are even more sparse. Camp regulations outline punishments for infractions such as escape attempts, insubordination, and refusal to work. Female prisoners appear infrequently in disciplinary logs, and when they do, the entries are brief. According to witnesses later recalled, this may reflect both lower rates of recorded infractions and administrative reluctance to document incidents involving women in detail. The records do not explain which factor was more significant. What these files reveal is not a hidden narrative of constant crisis, but a pattern of administrative quiet. Female prisoners existed within camp systems that did not fully anticipate them. The documentation reflects an effort to maintain continuity rather than confront structural limitations. This approach had consequences for how these experiences were later remembered. Post-war histories of POW camps relied heavily on aggregate data and representative cases drawn from the most complete records. Because female POW records were fewer and often less detailed, they were less likely to shape overarching narratives. History books tend to describe camp life through generalized conditions that applied to the majority population. The specific adjustments made for women, being informal and inconsistently recorded, rarely entered the broader account. Even when historians have access to these records, interpretation requires caution. The absence of detail does not necessarily indicate absence of difficulty. It reflects the priorities of wartime administration. Camp officials documented what they were required to document. Anything that did not fit existing categories was often reduced to minimal notation. Female POW records therefore demand a different reading strategy, one attentive to what is missing as well as what is present. The case of the unnamed medical orderly illustrates this clearly. Her file does not tell us how she understood her situation, what personal challenges she faced, or how she perceived the camp environment. Such information was never the concern of the record. What it does tell us is how the system interacted with her presence. She was examined, assigned duties, temporarily reassigned when medically necessary, and then returned to routine. The process unfolded without comment or reflection. The system did not record a problem because acknowledging a problem would have required rethinking its own design. Similar patterns appear in Red Cross inspection reports. Female prisoners are occasionally mentioned, usually in passing. Inspectors noted their accommodation and general condition, but rarely elaborated. Contemporary accounts suggest that inspections focused on compliance with basic standards, rather than on structural suitability. If women were housed, fed, and not visibly mistreated, the system was deemed acceptable. The deeper question of whether the system was designed for them was seldom raised. This has shaped historical memory. When later generations look back at prisoner of war camps, the image is one of standardized hardship endured by anonymous masses. Female prisoners appear as exceptions rather than as indicators of a broader institutional blind spot. Their experiences are often treated as footnotes, not because they were insignificant, but because the records that might have highlighted their significance were never designed to do so. What female POW records reveal, then, is not a separate history running parallel to the main narrative, but a fault lying within it. They show how wartime institutions manage difference by minimizing it. Rather than adapting rules, administrators relied on informal adjustments that left the official framework intact. This approach preserved order but obscured complexity. For historians, these records offer a reminder that documentation is not neutral. It reflects the assumptions and priorities of those who create it. In the case of prisoner of war camps, the assumption was that prisoners were male, interchangeable units within a labor and security system. Women who entered that system were recorded as prisoners, but not as a category requiring structural attention. The broader implication extends beyond gender. Female POW records highlight how large wartime systems responded to any deviation from the norm. When faced with cases that did not fit established rules, administrators preferred temporary solutions over formal revision. This tendency appears in medical care, labor assignment, housing, and discipline. The records capture these decisions indirectly, through patterns of omission and understatement. As the war progressed, the number of women in military and auxiliary roles increased, and with it the likelihood of their capture. Yet the fundamental structure of POW administration changed little during the conflict. According to camp correspondence from late in the war, higher authorities occasionally acknowledged the presence of female prisoners, but offered limited guidance. Comprehensive policy adjustments were deferred until after hostilities ended. The post-war revision of international humanitarian law reflects this delayed recognition. When the Geneva Conventions were updated in 1949, more explicit provisions were included regarding the treatment of women prisoners. These changes were informed by wartime experience, including the practical difficulties documented, however obliquely, in camp records. The fact that such revisions were necessary underscores what earlier documentation failed to address. Female POW records do not provide dramatic revelations or personal testimonies. They do something subtler. They reveal how history is shaped by administrative vision. What is recorded becomes visible. What is minimized fades from view. In reading these files carefully, historians gain insight not only into the experiences of women in captivity, but into the workings of wartime bureaucracy itself. The unnamed medical orderly did not alter the system she entered. Her presence did not trigger reform or provoke commentary in the official record. But her file, like others, exposes the assumptions embedded in the machinery of war. It shows how a system can function smoothly while still being incomplete. When history books rely on the surface coherence of wartime records, they risk reproducing those assumptions. Female POW records invite a more critical reading, one that recognizes silence as a historical source. They remind us that what is missing from the archive is often as telling as what survives. In the end, these records reveal a war administered through forms and procedures that could not fully account for the realities they encountered. The experience of female prisoners was not erased, but it was compressed into a framework that left little room for difference. By examining these documents closely, Historians can see beyond the apparent order of wartime systems and better understand the limits of the structures that governed captivity during the Second World War.